morning, everyone. Communications Director Brianna Aho. We're just about to get started.
And as you know, on Friday, the United States Department of Health and Human Services released a rule that will eliminate funding to Title X family planning providers who, using non-Title X funds, also provide abortion services. We're here today to announce that we will shortly, after this rule is published, be filing a federal lawsuit in the Eastern District of Washington challenging this transparent attack on Planned Parenthood and assault on Washington women. I'm working extremely hard to put this together. Look, it's relatively easy to stand in front of you. A special thanks to South City Council member Lorena Gonzalez, who is in this crowd behind me. So, once again, and we've been here before, President Trump is violating the law. This time, he is inserting his politics between a woman and her health care provider. Their own lawsuit, also in the Eastern District of Washington, against this rule. And it's important to me to communicate to the people of the state on big issues like this. This rule will force out of the program professionals who provide nearly 90% of Title X family planning services to Washington patients. Rural communities in Washington currently have a shortage of healthcare providers. This rule will make this shortage even more acute and leave Washingtonians in 21 counties without access to a Title X provider.
Good morning, everyone. I'm Communications Director.
The Trump-Pence gag rule needs to be challenged because it blocks doctors like me from being able to refer their patients for safe, legal abortion. As a doctor, I cannot imagine withholding information from my patients. It's unethical, and it flies in the face of the oath I took to take care for my patients.
Shortly after we file our lawsuit, we will be filing a motion for a preliminary injunction, which asks the court to block implementation of this rule before it goes into effect. We will file for a preliminary injunction well before the 60-day clock is up to make sure this rule never goes into effect. The work of our office in challenging this administration, providing resources and assistance in many ways. First, Aaron Berry from the Washington State Medical Director of Planned Parenthood. But I think a key part of it is that the administration continues to enact policies that are in direct contravention to federal law, whether it's, to Joel's point, the Administrative Procedure Act, or as Jeff was saying, Affordable Care Act.
Healthcare, but for the ACLU, it is also about checking unfettered executive powers.
Arguably affected by this rule more than any other organization.